Hi viewers, welcome to CK Smarter Creations. Our topic today is on high blood pressure and danger signs to watch. If it is your first time to watch me and you haven't subscribed, kindly subscribe so that we can continue learning together. So what is high blood pressure? High blood pressure is often called or referred to as a silent killer. And this is because it usually has no obvious symptoms until it reaches very dangerous levels. So, warning signs like chest pains, shortness of breath, vision changes, or even severe headache may indicate a hypertensive emergency. And in such cases, immediate medical attention is very critical. So, when do we say that someone is hypertensive or someone do not have high blood pressure? So, I'm going to explain the two readings that one gets whenever you do or whenever you check your blood pressure. We normally have two readings, the top one and the bottom one. The top one is called the systolic and the bottom one is called the diastolic. So for you to say that you have a normal blood pressure, the systolic normally reads at 120 and diastolic at 80, 120 over 80. So this is a normal blood pressure. When we say that you have elevated blood pressure, it is when the systolic reads between 120 to 129 and the diastolic reads at 80. When we say that you are at stage 1 hypertension, this is when the systolic reads between 130 to 139 and the diastolic is at 80 to 89. Stage 2 hypertension is when your reading for systolic is 140 or greater and diastolic at 90 or greater. And we normally refer you to hypertensive crisis when your systolic reads at 180 and greater over 124 diastolic. So why is hypertension called a silent killer? This is because most people do not have symptoms. The other reason is because hypertension damages occurs silently. These damages occur to things like your arteries, which stiffens, and your heart works harder. And it can also make you to have long-term risks, and these risks are things like stroke, heart attack, kidney diseases, and some people get dementia. So what are the danger signs to watch for when one is hypertensive? One is shortness of breath. 2 is when you're having chest pains or palpitations and yet you are hypertensive. Number 3 is when you have changes in your vision, like you start seeing blurry vision or sudden loss of vision. You're not able to see. That is also a danger sign. The other sign that is a bit rare is when you start having things like nose bleeding. That one is also a danger sign. We also have some people who get some neurological signs, and these are things like start feeling weak, numbness, difficulty in speaking, the tongues sometimes get heavy, some people's mouth will twist a bit, or the eyes sometimes get smaller, one eye. If you notice this with your friends, with your relatives, that is a danger sign, and you should take that person to the hospital immediately. So if you are having these symptoms, if you're having any of these symptoms, please seek for medical attention. Also, keep on checking on your blood pressure. Ensure that you have even a blood pressure machine at home. It is not that expensive. Invest on one. Invest on one, and when you invest, you'll be able to monitor your blood pressure at least every day. Ensure also that you see a physician for checkups. A physician will advise you on what medication to take. A physician will also keep on checking on your organs. They will send you to a lab, and when you go to the lab, the tests that you need to check when you're hypertensive are one, ECG that checks on the heart rhythm. The other test is a lipid profile. Remember, when your cholesterol levels are very high, they can make you have hypertension, because cholesterol normally blocks your heart arteries, reducing the surface area where blood passes, and thus causing hypertension. It's also very important to check on your sugar levels. It's also important to do a thyroid stimulating hormone, because sometimes when you are having hormonal imbalance, it can also result into things like hypertension. So make sure you check also on your liver, check on your kidneys to see whether you have organ damage. And also, very important, very critical, to have an eye checkup. Make sure that at least once in a year you check on your eyes to rule out things like cataract that are caused by high blood pressure. Thank you for watching. Again, if you haven't subscribed, kindly hit the subscription button. If you have anything else to add, hit on my inbox and let's continue learning together. Thank you for watching, and thank you for your time.